My name is Julie Marsh and I'm a Senior Associate Solicitor with Boys Turner Solicitors. I've been working with people injured as a result of medical negligence for the last 11 years. Some of the most life-changing and devastating injuries I've seen occurred after a delay in diagnosis and treatment for Cauda Equina syndrome. Almost everyone will suffer with an episode of back pain during their life. That in itself can be debilitating enough, but often only lasts a few weeks and can be eased with treatment and painkillers. Cauda Equina syndrome is a condition where the nerves at the bottom of the spinal column become compressed and the blood supply to them is compromised. These nerves, called the Cauda Equina nerves or horse's tail, help control bladder and bowel function, sexual function, and when they become damaged, the messages to these vital organs become interrupted. This can result in lifelong symptoms that can affect every aspect of someone's life. The damage to these nerves can result in urinary retention and bowel issues, a loss of feeling in the perineal area, and people can also experience foot drop and sensory issues with one or both legs. Today, I'm pleased to be joined by Allison Whitehorn, who was diagnosed with Cauda Equina syndrome in 2014 and has been living with the after effects ever since. Hi Alison, thank you very much for joining me today.
Hello Julie, thanks for having me.
So Alison, you suffer with Cauda Equina syndrome and you've kindly agreed to talk to me a bit today about your own diagnosis and the treatment you had and how you coped every day with your ongoing symptoms. Had you ever heard of Cauda Equina before you were diagnosed as suffering with the condition?
No, I was never heard of it before, not really until after the surgery when I was told from my GP and a letter came from the discharge from the hospital and I didn't even understand it then. So the problems I was left with was quite shocking.
And what were your symptoms of Cauda Equina before you had your diagnosis and operation?
I had 3 years of continued sciatica and numbness going into my legs and issues with going to toilet. Bladder work since the May, and I had excruciating back pain.
And what's your condition now?
I'm unable to walk far. I can do just literally a few steps, like to transfer, and I'm in a wheelchair, rely on the wheelchair. I get a lot of nerve pain, lots of cramps, and I have bladder and bowel issues.
After your diagnosis, you had major spinal surgery, followed by a period of recovery. But what aftercare and support did you receive then?
There wasn't any from the hospital. It wasn't until I went to the GP, he referred me to the incontinence service and the physio. The physio wouldn't touch me due to the Cauda Equina, which required specialist neurophysio. And I was taught intermittent self-catheterisation, but didn't really have anything else.
And there were issues with the self-catheterisation, wasn't there?
Yes, I was taught from a normal general hospital, just basically told how to do it, not shown or anything, but because I cannot feel where I am, it was very difficult.
I understand that you did find some help from the Spinal Injuries Association. How did you find out about them?
I was looking online on how to use the catheters and contacted them. A peer support officer spoke to me and directed me to the spinal injuries at Salisbury Hospital, where the spinal nurse came out to my house who assessed me, and I had bladder treatment there where they did a urodynamics, and then they taught me how to self-catheterise.
And how do you cope day to day with the issues that you face?
I find it a struggle most days. My mood swings are very good really, but I do get days where I feel quite low when I get frustrated with myself. Talking to others, everything has to be planned.
And how do you manage to stay so positive?
Just having good people and support around me now, I'm very positive, and I believe that you've got to get through life somehow, just being positive, because it's not guaranteed you're going to get there without any illness or problems. Making the most of what is.
And I understand that you're working as part of a support group for other people.
Yes, I am. Yeah, I'm working for the Cauda Equina spinal cord injury, and that's for anyone with spinal injury, lower injury, and Cauda Equina to support one another. And we now have the backing from SIA. So if anyone needs anyone to reach out to, we're here. So if anyone wants to join, they can ask questions and get support from there.
And is that a Facebook group that's set up?
It's a Facebook group, yes.
That's great.
Thank you.
It's been really great to talk to you today, and thank you very much for sharing your story with me and for everybody who's been watching this. I think you're incredibly brave to share your personal experience of Cauda Equina syndrome and the challenges that you face each day, but you're also really inspiring to others. I think anyone who's been through a diagnosis of Cauda Equina syndrome will really benefit from hearing your story. It's been fantastic that you've been able to take what's happened to you and share it with others so that people can better understand the condition, but also offer support to each other. Thank you again for joining me. I wish you all the best for the future. And to anyone who's suffering with symptoms after Cauda Equina syndrome, I really encourage you to reach out and seek support and help from those who've been through it, who can offer it to you.
Thank you very much, Julie.
Thank you.